Dunque, io direi di iniziare a questo punto. Possiamo iniziare perché sono le 5, superate ormai da un paio di minuti. Chiedo, Luigi è collegato con noi?
Sì,
Luigi
sì.
Marengo?
Sì, ci sono.
Io saluto i partecipanti all'incontro di stasera, il terzo incontro, il terzo webinar che facciamo come SIE su questi temi del Covid-19. In questo caso il tema che tratteranno i relatori, è quello relativo alla compliance con le misure di distanziamento sociale. Abbiamo 4 relatori, immagino che Luigi poi andrà nel dettaglio, se vorrà, e nelle presentazioni dei relatori e nelle presentazioni se vogliamo, dei temi che vengono toccati. Io li saluto semplicemente, Guglielmo Briscese, Nicola Lacetera, Mario Macis e Mirco Tonin, e li ringrazio molto per averci dedicato tempo e i risultati della loro attività di ricerca. Semplicemente una informazione relativa al fatto, e lo dicevamo prima per coloro che erano già collegati, chi volesse fare domande, è previsto uno spazio per le domande dopo i 40 minuti di presentazione, lasceremo 15 o 20 minuti di tempo per le domande. Non usate la chat, ma fate le domande usando la funzione Q&A, perché in questo modo almeno i relatori possono direttamente vederle e rispondere alle domande. Lascerei la parola a Luigi Marengo, collega di SIE, del Consiglio di Presidenza di SIE, che ringrazio molto per aver dato la disponibilità alla gestione di questo seminario. Prego, Luigi.
Grazie, buongiorno a tutti e benvenuti. Io sono Luigi Marengo, faccio parte del Consiglio di Presidenza della SIE come Marco Cucurelli che mi ha preceduto. Allora, prima di tutto la regola per questi seminari è che si parla in italiano, le slide sono in inglese, a meno che nell'audience non ci sia qualcuno che non capisce l'italiano. In questo caso ci mandi un messaggio. So I say it in English because in case so there is a contradiction in what I'm saying. If there is anybody in the audience, so the rule is that the seminar is in Italian and the slides are in English. If in the audience there isn't anybody who does not understand Italian, just send a message and also the presentation will be in English. Otherwise, we keep talking Italian, but with slides in English. Okay, I don't get anything, so we switch back to Italian. Allora, parliamo italiano. Queste sono le regole generali della SIE e noi obbediamo. Allora, prima di tutto do il benvenuto, abbiamo tutti e 4 gli autori. C'è un paper...
scusa per l'interruzione, ma c'è una persona che ha scritto English, please.
Ah, ok. Sorry.
Vedo su Q&A.
Just after I switch to something else. Okay, so we switch to English. We do also the presentation in English. Okay? Of course, you can ask questions in Italian if you don't feel comfortable in asking questions in English. And as Marco mentioned before, please use Q&A for asking questions. So the seminar of tonight it couldn't be more on a hotter issue than that because it's about COVID. It's actually based on a MBR paper, which came out, I think a couple of weeks ago. I saw it in MBR, I think 10 days ago, something like that. But the presenter just told me that we are going to present also some additional results which are not on the paper. And this is based on an inquiry with a sample of Italian residents. And they basically pose questions to these Italian residents during the time of lockdown on their attitude towards how they feel about self-isolation, how they feel about lockdown, especially in relation to the kind of announcement they get. And in particular to the announcement of the time of the duration of the lockdown and the expectation about the end of the lockdown. And as you're going to see, they actually touch some things which are about perception of the communication, persuasion, which are much broader. For instance, I work mainly personally in organizational issue, and what we are discussing has also a lot to do with what happens in organization, what bosses announce, how credible it is, and what are the expectations they generate. So the work is really extremely interesting, and we look forward. I think Guglielmo will do the entire presentation, and then the other speakers will be available also for the Q&A. Thanks, Guglielmo. The floor is yours.
Thank you. So I'll start by sharing the screen, but it says here the host disabled participant screen sharing. So if Daniele Luigi can please enable that, I'll be happy.
I think Daniele has to do it. I'm not.
Daniele dovrebbe aver abilitato la possibilità per te di condividere lo schermo, però glielo sto dicendo, lui di solito ci sente.
No. Io
ho la possibilità di farlo, però no, non mi sembra il modo più adeguato.
No, verifichiamo.
Sì.
Ok.
Sorry, in the meantime, I take advantage and introduce briefly the speakers. There are four Italians, but all around the world. Guglielmo is at the University of Chicago. Nicola, Lacetera, University of Toronto. Mario, Johns Hopkins. And Mirco, Tonin is the only one who is actually in Italy, in Bozen-Bolzano. Well, Italy, so to speak, on the border.
Ok, se potete verificare.
Sì, potete vedere le slides?
Sì, vediamo. Sì.
Everyone can see?
Yeah, we can see it.
Okay, excellent. Okay, so shall I begin?
Yes, please.
Yes, please, Guglielmo, go ahead.
Great. Well, first of all, thank you, Professor Cuccolelli and Professor Marengo, for the invite, and thank you for organizing these great seminars. And thanks everyone for participating today. So as the introduction flagged, this is a study that is still ongoing, for which we released a working paper some weeks ago, but it was followed up by a series of articles that were shared on some blogs and magazines such as ProMarket and others. And it's still work in progress, so we're hoping to share some insights and results that you have not seen before, and at the same time get some useful feedback and comments from you. So the study that I'm going to present today is conducted in partnership with the four co-authors that you see here. So as you can see, they're all much more serious and senior than the presenter. I'm hoping to do a good job at summarizing the early findings and insights. So the study is about compliance with COVID-19 social distancing measures, in particular in Italy. And we are looking at the people's expectations around the timeframes and the duration of these lockdowns, or the social distancing, or what the Italian government referred to as the io sto a casa, like I stay at home measures, and people's planned behaviors. Let me begin with the motivation that drove us to explore these issues and the behavioral angle. Why do behaviors matter? We know that unfortunately, when it comes to COVID-19, health solutions are still not readily available. Some epidemiologists and virologists are talking about a vaccine that might not be available until early next year, unfortunately. Some pharmaceutical treatments that might be used to reduce mortality. The mortality rate are also being sort of cautious findings or mixed findings. And the early findings from some serological tests, such as the ones that were released, I think yesterday or 2 days ago from the government of Spain, are showing that also in areas with a high prevalence of COVID-19 cases, very few people, I think something around like 5 to 7% of the population actually develop antibodies. So this means that from a health perspective, the fight against this pandemic is going to be a bit of a marathon rather than a sprint. So we're going to have to be patient, and the health solutions are not readily available. What we've seen is some countries also exploring the solutions that are more, that have to do a little bit more with technology. So we heard about South Korea, Australia, and Singapore implementing the so-called tracing apps, which are apps that you can download on your smartphone, which ideally can help identify and track individuals who might have been in contact recently with a person who then tested positive. The latest findings, I think there was an article from the Financial Times and other Bloomberg yesterday and 2 days ago showing that even those countries that have adopted these measures are actually finding mixed results. Sometimes these solutions work, some other times they don't work. So these solutions are proven difficult to implement and enforce, even where there is actually the buy-in from the population, let alone in countries like in Italy, for instance, where these apps have been debated and there's still not strong agreement and support for this type of policies. So really, when it comes down to the type of tools and incentives that policymakers can leverage on and use, at the end of the day, behavior remains the most important and most effective tool. At the end of the day, it's whether or not people comply, whether or not people decide to respect the rules of self-isolation and reduce the spread of the virus. And we're seeing now the particular case of Italy, which is the scope of the study, that is transitioning to this phase 2, as many other countries also are doing and others will be doing. Behaviors matter even more when it comes to this reopening phase. The success of the reopening phase is strongly dependent on whether or not people will, in fact, comply with the guidelines that their governments have issued and flagged. So from a behavioral point of view, why don't people respect the rules, even if it means saving their own lives and saving the lives of their fellow citizens? Well, one thing that we know is that self-compliance can be hard. Okay, so it's not completely rational as to why people might not necessarily respect the rules. We know that there is definitely a psychological and an economic cost to social isolation. For some people, it's particularly more difficult than for others. Some psychologists have talked about the potential of what they call the isolation fatigue, which is basically a psychological effort that you have to put into self-isolation. For a lot of people, isolation also means a loss of income. So there's definitely a cost. So there's definitely an incentive, whether it's intrinsic or not, for people to not respect the self-isolation measures. We've seen also that other types of incentives that policymakers have available have proven having very limited success. Some countries, especially also like in Italy, some governments have introduced some formal enforcement, such as deterrence or the tracking apps we talked about before, or even fines for people that don't respect the rules. For instance, in some places in Italy, you might be fined if you ventured a few miles, a few kilometers away from your place of residence, and yet we kept reading the news that the fines just skyrocketed and people kept not following the rules. So at the end of the day, really compliance relies on the individual attitudes and intentions. And so we wanted to understand a little bit better what is it that policymakers can leverage on, but also at the same time, what is it that drives some people to respect the rules and some others not. And we believe that there is definitely an important role that communication and persuasion and trust in institutions play in shaping people's behaviors and attitudes towards compliance when it comes to COVID-19. And we've seen different policymakers in different countries using different communication techniques, some slightly more controversial than others. We've seen, for instance, in the Philippines, Lacetera ordering the police to kill citizens who would defy lockdown. I think social media was flooded with some images and videos of police officers, for instance, in India, hanging around with like 1.5 meter long sticks, bashing people that wouldn't respect the rules. We have seen also some other cases in China where the isolation rules were quite strict, and they did not feel like they, the government decided not to give a definite end date. So on top of incentives, they just said, the isolation measures will be in place as long as needed. And Canada also, which is, contraposed to China, is a democratic place. And they also decided to have slightly less strict rules, but nevertheless not provide a specific end date. That is different from Italy, where the rules were actually quite strict. You could be fined if you did not stick to your place of residence, or if you defied the self-isolation measures. But the government, for a reason or another, decided to give specific end dates. This is not an isolated case. It's the same in the US, where different states decided to give different end dates. And what happened, just like in Italy, also in other US states and other countries, the government had to revise these end dates constantly as new information became available on like contagion rates, COVID cases, or death rates. And so our question was really more about like, how does these type of communication, how does this anchoring affect compliance? So do the expectations about the duration of the lockdown and possible extensions influence the willingness to comply of people? So if I told you a date and then I revise the date and then I revise it again and again, does that have an impact on your willingness to respect the rules or not? And the second question is, does the expectation vary depending on the current level of compliance or any other characteristics? So if you're already not respecting the rules, does it really matter whether or not the government revises these deadlines and timeframes? Does it matter where you live? Does it matter who you are? And more recently, we also explored this question in the context of the reopening phase, what in Italy we call the phase 2. So which is, does the end of the lockdown imply readiness to return to normalcy? So if people are impatient to go back to the way things were before, are they willing to then respect the rules? What are their expectations around the safety of, for instance, attending certain places? And what are their expectations around a potential second wave of contagion and potentially a second lockdown period? So to answer these questions, we decided to collaborate with what is perhaps the most famous Italian survey research firm. It's called SWG. I think they're based in Trieste. And we decided to do a multi-wave cross-sectional survey, which means that in every wave, we follow about 800 to 900 Italians, which are a representative sample of the Italian population. And it's not always the same people, but it's always more or less a representative sample, more or less the same size. If you want to see where our waves fall within the sort of time frame of COVID-19 in Italy, you can see from this slide that we have paid particular attention in implementing and launching the different waves of the survey at specific points in time during the lockdown period. So you can see that the first wave was shortly after the government announced the very first lockdown, which was announced, I believe, on the 12th, between the 11th and the 12th of March. And the very first deadline the government announced was April 3rd. That was followed by a suspension of most economic activities. I think just before the deadline, the very first deadline of April 3rd, the government announced on April 2nd an extension of that deadline to April 13, to just then further extend it again until May 3rd. And now Italy has recently then transitioned to this like phase 2. So as you can see from the bottom of this chart, those are the 5 ways that we have implemented so far and where they fit. So the first 3 waves were focused on understanding people's willingness to comply with the isolation measures, whilst the 4th and then the 5th, and now potentially another follow-up one, have focused more on people's willingness to return to normalcy. But the research questions are the same as we sort of implemented these 5 waves. So I'll try to translate these on the fly now, because I prepared them in Italian, which was the original language that obviously we used in the survey. So in the first 3 waves, we asked the same questions. So first of all, we asked people, the respondents, a bunch of questions around their level of compliance, what are the type of behaviors they're engaging with now, whether they're wearing masks, whether they leave their homes or not. And then after that, we asked everyone to guess the end date. So we wanted to see every time in the different waves if they knew about what were the announced end dates. And then to fix, so that if you want to address potential misunderstanding or heterogeneity of understanding of the end dates, we gave everyone the actual true information, which was the actual end date announced by the government. So we said the end date of the self-isolation measures announced by the government is the 3rd of April for the first wave, the 13th of April, and so on for the following up waves. And then we asked everyone, do you think that these measures will end on the date, on the actual date that the government announced? So that's option A. Do you think they will extend it by a few weeks? Do you think they will be extended by a few months? Or do you think they will be extended for as long as needed? And then after that, we asked everyone to answer a question based on 3 different scenarios. And we asked if the self-isolation measures had to be extended by a few weeks or a few months or as long as needed beyond the end date of the 3rd of April for the first wave, or the 13th and so on for the second one, which of the following options best describe what you are willing to do and what you intend to do? And the first option says, well, I think I would significantly increase my self-isolation efforts. Option B says I would increase it by to a certain extent. Option C says I would just keep behaving the same way that I've been behaving so far. Option D says I will reduce my self-isolation measure in some way. And then the last option was I will significantly reduce, or I will actually decide not to follow the rules any longer. And we randomly show the order of these options A to E in order to avoid any anchoring effect. But every respondent saw the same 3 questions. So they had the very first question around the end date and their expectations of whether the end date was going to be the actual end date. And then everybody saw the 3 scenarios, like what would you do if the measures were extended by a few weeks? And then what about a few months? And what if the measures were extended as long as needed? This allowed us to basically create a matrix of matching scenarios to the expected end of stay-at-home measures. Okay, so we call this variable a matching variable. So you can see that if the individual expected the measures to be extended by a few weeks, so that was the option B in the first question, and then we think they think that the scenarios that is going to be what they would do, in the scenario that the measures were actually extended by a few weeks, we consider that a match. So you can see the diagonal is the same by the few months scenario and extending indefinitely scenario. So that allowed us then to see what would happen, basically. What would people do if the measures were extended by a scenario that did not match with their expectations? So if they were expecting the measures to actually end in the announced date, what would happen if the measures were actually extended by a few weeks or a few months or indefinitely? So that allowed us to see this, what we call the effect of bad surprises. So that is, if you want, the right-hand side of that table, that is the scenario in which basically the measures are extended longer, somehow longer than you originally expected. And this is what we see around the self-isolation intentions by this potential mismatch between the expectations and the potential extension scenarios. As you can see, you can see basically here, I'm not sure if you can see my mouse, but basically the people that report their willingness to increase their efforts in maintaining or increasing their efforts of social isolation decreases as the expectations mismatch with the scenario. So what that means is that if the scenarios if the measures will be extended in a way that is much longer than they originally expected, their willingness to increase their self-isolation efforts actually goes down. And the opposite is true for the willingness to, or the intention to reduce their self-isolation intentions. Okay, so this is the effect, if you want, of bad surprises. So for those who say that they would maintain their self-isolation efforts as they are, we don't see a significant effect, but we do see a significant effect here. So this is what we define in the paper as the bad surprises effect. We then looked a little bit deeper into who are these respondents and what do they do at the minute. So as I flagged before, the very first question we asked everyone was, what was their current level of compliance? In particular, we asked everyone to select in a multiple choice where they could select all that apply options. What were the current behaviors that they were engaging to reduce the spread of the coronavirus? And we asked everyone to take a few options. So one was avoiding crowded places or avoid meeting friends, avoid meeting relatives, keep a safe distance when in public or around others, limit going to groceries, or leave the house only if necessary. So if a person selected all of these options, it means that they were what we call the full compliers. So these are people that respected all the rules and trying to engage in all virtuous behaviors around social distancing. Those that instead complied with only a few of these measures were partial compliers, according to our definition. And what we see is that there is a difference when we dig a little bit deeper into the heterogeneous effects between the full and partial compliers. So you can see from this slide that on the left, you have the responses from the full compliant, and on the right from the partial compliant respondents. We, for ease of readiness of the graph, we just removed the people who have responded that will maintain constantly their self-isolation efforts. So as you can see, the effect for the full compliers, the difference is slightly more staggering. And so we think that there might be a case of self-isolation fatigue. So as you can see, the number of people that would report an increase in their self-isolation efforts goes down as the expectations mismatch the potential scenarios. And the people that report instead a reduction in their self-isolation efforts increases in the same sort of way. And this effect is slightly less for the partial compliers. So as you can see, the differences are less strong. What we see then is, so as I said before, we replicated the same questions over the first 3 waves of the survey. And that allowed us to compare people's responses across time, right? And over the first few weeks of the first month of the lockdown in Italy. So as you can see, the difference here is quite staggering when it comes to the expectations of when the measures would end. So we see in the 3rd wave, which is the closest one to the actual end date of the lockdown, most people started to respond that, or more people started to respond that they thought that the measures were actually going to end on the date that the government announced. And the opposite is true for as long as needed scenario. So what we see here is that as we approached the 3rd extension that the government announced, the Italians basically started to think a little bit more that the last extension was really going to be the last one. So potentially their optimism grew or their impatience grew, but in the very first wave, as you can see, a very small number of people in the first and the second wave thought that the government was actually going to end the lockdown on the date that they announced. Whereas on the last one, we're getting closer to almost half of the respondents. And again, the opposite is true for the scenario where we said, do you think the government will extend the measures for as long as needed? And this is the interesting bit, I think, is that we see that the willingness to comply is basically the reduction in the willingness to comply increased with the mismatching of expectations over the 3 waves. So this is, if you want, a shorter version of the different scenarios that we showed before, just for ease of read. Again, you can see that we don't see a big difference between the first 2 waves on the effect of the mismatching of expectations, but we see that in the 3rd wave, these changes. So in the 3rd wave, we see that the willingness to comply is reduced already, even in the case of good surprises. and the potential of reduction, if you want, to the willingness to comply is substantially higher in the case of bad surprises in the last wave. So if we were to summarize the key takeaways and key results from the first 3 waves, we can see that basically people's willingness to comply decreased over time. So we see that across all 3 waves, about 80% of the people did not leave home unless strictly necessary. This is not a surprising finding because we know that people could still be fined until a few days ago for leaving their homes if they did not have a good reason to do so. However, we see that the fully compliant respondents dropped from 50% in the first wave to 42% in the last wave. And the share of respondents who reported an intention to reduce their compliance was also higher, regardless of the expectations in the latest waves of the survey. So it's unclear whether this is, a refound or a new optimism, or is just that Italians grew more and more impatient. What we know is that in the first wave, 40% of the respondents expected the measures to last only a few extra weeks, compared to 70% in the wave 2. And in the third wave, most respondents expected the measures to end on the day that the government actually announced. We also find, interestingly, a better than average effect. This is something that has been studied extensively in behavioral economics and experimental economics, is this idea that we think that we behave better than others. It's a little bit like those findings of other studies that show that most drivers think that they're better than average. And we see that this is also the case in the self-isolation efforts of Italians. About 40% of respondents felt able to keep their self-isolation measures for extended periods of time, but they only believe that about 15% of the population will be able to do the same. And this is important because, as we'll see, social norms play a very important role in shaping people's attitudes and willingness to comply. So then that leads us to the other last 2 waves, where we instead wanted to look at the people's willingness to comply with self-isolation measures when it comes to the reopening phase. And so what we've seen in Italy is images like these. Now, this might be a selection bias, it might be that not in every single town or in every place we see this optimism again, but there's definitely something around the importance of respecting the rules again when it comes to the phase 2. So in the last 2 waves of the survey, we asked Italians about their willingness to return to normalcy. Specifically, we said the questions on the left, which I'll try to translate on the fly again. We said, do you think that given the current situation in your region, it's the right thing to do to reopen the economy and to return to normalcy? And then we asked, do you think, given the current conditions in your current situation in your region, what's your willingness to attend these economic activities that have been reopened again? And do you think that most people will be interested to attend these places, these economic activities? And then we asked everyone, do you think that the measures of self-isolation will be eventually reintroduced? And if yes, when do you think that will be? And this is quite interesting. What we see in the wave 4 results is that Italians think that, for most economic activities, more than half of Italians thought that most economic activities should be reopened, with the exception of probably cinemas and theaters or gyms and swimming pools, which potentially are the ones that, being indoor, in slightly more crowded places, people are slightly more scared about. But the interesting thing is that fewer people reported that they would actually attend these places. So this might be a case of other regarding preferences, where Italians are worried about the impact that COVID-19 is having on the economic activities across the country. So they think it's the right thing to reopen bars and restaurants, or hair and beauty salons, or urban transportation, but that doesn't mean necessarily that they will attend these economic activities or that they will make purchases in these places. And again, interestingly, they think that others will do though. So when we look at the proportion of respondents that said that they think others will attend bars, restaurants, hotels, shopping malls, and so on, is substantially higher than they would do. So again, there is a social norms or a better than average effect, again, playing a role here. So to summarize the key results from the wave 4, what we've seen is that Italians have a tendency to perceive outdoor activities that have reopened slightly more favorable than the indoor ones. So a larger share of the sample reports an intention to visit outdoor recreational places rather than indoors. However, as we know, especially during the summer periods, bars and restaurants are quite important, probably one of the most important economic activities for the country. But the share of Italians who intend to return to those places is also quite modest. And I think it's important to keep in mind, since the government will have to introduce certain measures to relaunch the economic activity of the country, just because lockdown measures have been relaxed, that does not necessarily mean that people will start to consume in these places again. The perception of readiness also varies quite a bit. Only 33% of respondents believe that the conditions to reopen were met in their region. And they thought, about 44% thought that we actually needed, it will take a few more weeks for their region to be reopened again. As I said, like the fact that some economic activities should be reopened for most Italians doesn't mean that they will go, even though they think that others will go. And the expectations are still not too optimistic. So about 40% of respondents expect the social isolation measures to be reintroduced following a second wave of the epidemic, potentially in autumn or in winter. About 20% thought that this was needed in a few weeks, and 11% expect that to happen in the summer. So only about 22% of the sample thought that the social isolation measures would never be reintroduced again. So what that means is that there is definitely a growing impatience among Italians. We've seen that impatience grew over time as the government kept changing and readapting the end dates. And at the same time, there is a cautious optimism, and we're actually seeing that optimism, people are more optimistic about what others will do and what is the right thing to do for the government. But when it comes to their own self-reported behaviors, they are not that optimistic. And probably, even though they were impatient to return to normalcy, they might not be that ready to return to normalcy quite yet. So the next steps is that we are waiting on the data from the wave 5, which is a replication of the questions that we asked in wave 4. And the interesting bit this time is that we are going to have data on basically on self-reported behaviors in the first few days of the reopening of the economy, so we can see whether actually Italians are now slightly more optimistic or not. The other thing that we're going to try to unpack going forward is how do people form expectations? So we've seen that definitely the idea of announcing an end date and then revising that end date doesn't work quite well. But is that the same depending on, for instance, where you get your news from? Does the type of political affiliation matter? We've seen studies, for instance, in the US, where everything is extremely polarized around Democrats versus Republicans, and people's willingness to comply or their expectations about the duration of the lockdown changes depending on which politician or which news channel they get their news from. And we are also going to try to match a survey data on the planned compliance with the actual behavior based, for instance, on food traffic or fine data that is available from the country, from Italy. And we are also considering potentially administering a second set of questions, or like a 6th wave, if you want, in case of a potential second lockdown. Obviously, we're keeping our fingers crossed that our family and friends will be safe and the second lockdown will not be needed. But in case that's needed, there is a an important question for policymakers and for Italians more generally on what is going to happen. What are people going to do? Are they still going to comply? Are they going to comply more or less now that they had a few weeks or actually a few months where everything returned to more or less normalcy? So I'll stop here because I'm conscious of time, and I'll stop sharing the slides, but I'm happy to take questions.
Okay.
Or maybe I just wanted to open to Mirco and Nicola if they wanted to add anything. And Mario, I think he's still online.
So there were a few questions in the Q&A during...
a couple of questions.
Yeah, I answered a few, but there are some others.
Directly and answer.
Okay, so I see, did you try to reduce social desirability bias in any way? Yes, so we definitely randomized the order of the options that of the scenarios. So when we asked respondents, for instance, on whether they would comply or not, depending on the scenario, whether the measures were extended a few weeks, few months, or indefinitely, we changed the order of those, mostly to avoid anchoring effects. Social desirability is definitely something that applies to most surveys, I'd say. It is something that we are going to try to control a little bit more in the regressions. Probably an interesting thing is to compare the data with the actual data around foot traffic, for instance, or the fines. Interestingly, we see that that behavior is quite consistent, and the responses are quite consistent depending on like the demographics or the location of people. So one hypothesis is that Italians who live in the so-called red zones or the region of Lombardy, where the measures were slightly stricter and the situation was obviously more dramatic, we would expect maybe like a higher social desirability there, and we do not see that. So we see that the answers are quite consistent and robust to demographics and geographical location. I see another question from Francesco on how could the government use your analysis? We've actually had quite interesting feedback from quite a few policymakers on how they've already used our analysis. I have former colleagues from the government of Australia, for instance, that called me asking for some tips. I know that Nicola has taken a lot of interviews in Canada. We've tried our best to share it as widely as possible and to share these results also as in a way that was as timely as possible. Fair to say, probably we got better feedback from countries other than Italy, but we know that governments have used these, and they've used it particularly in shaping their communication strategy. So for instance, some governments have already decided to manage people's expectations a little bit better by flagging, for instance, a specific end date, but understanding or explaining slightly in a more clear and transparent way that that end date might be revised depending on new evidence or new data and new information that the government had access to. And I think that is something quite important that I haven't seen the Italian government doing as well as other countries.
There are also some questions, but I don't know why they ended up in the unanswered questions. If you click on that, there are some questions which actually I don't think you answered, but...
Okay, I can see
I provided responses though during
you
the talk,
did.
so
Sorry,
it should be okay.
Sorry for that.
No.
Is there anyone that I haven't responded? I think, do you think trust in politicians play a role? For sure. I think we do have data on political affiliation, so we'll be able to see based on the respondents' political views whether or not the party that is currently in power in Italy matches with their political preferences. So it might be, if that is the case, that Italians think and see the pandemic through the same lenses as Americans do. For instance, we know that in America, it really matters which politician endorses certain measures. So trust in the system and trust in politicians definitely matters. There's another study that has shown, for instance, that there's a strong correlation between willingness to comply and trust. So we know that in countries like New Zealand, where there is a very high trust in government and policymakers, people are more willing to respect the rules. Same is the case in Australia, where there's a very high level of trust in government, and it's not, a case that it's not surprising that a lot of people, for instance, downloading this tracing app in Australia right away. So that definitely plays a big role.
But we haven't checked. Let's say we can check in whenever we want, because we have the data, but we haven't looked at it.
Yeah. The other one was around how did you reach people to interview? So we delegated that to the SWG. So SWG is this well-established survey research firm that has a panel, like most research firms do. And I think it's a panel of like 60, 70,000 Italians that they've built over time. And they select a representative sample. And I believe the interviews are done, some are done online and some are done over the phone. They normally do the ones over the phone for the proportion of the sample where respondents don't have access to the internet, or for like factors such as age, they might be more familiar and with like a phone interview. But we do control for those things, and the methodology that the firm uses controls for that to make sure that the answers are comparable.
Just on this, Riccardo, because do you know whether the interviews were done in the same day or different days? Because actually, I think that the degree of general optimism and pessimism changed quite, especially in the first weeks, quite abruptly from one day to the other. No, for instance, every night, and apparently became a big issue in Italy, the number of deaths of the day were announced. And this, of course, I guess I saw it upon myself and my friends and my family. But of course, this influenced quite a lot the mood of people. No, if you ask a question, a day in which there is a gloomy picture, lot of death, and the media, inevitably. So, do you have any control for that? Do you?
So we were definitely able to introduce in our regressions as controls the number of COVID cases and deaths by location. So it's something that we could control for. The timestamp from the data is not readily available from SWG, but what we did to minimize the time effects is to make sure that the survey was implemented over a period of no more than 2-3 days. So if there's any and we've been, as you've seen from one of the first slides, we've been very careful around the timeliness of the launch of the survey and the end of the survey to make sure that we could control as much as possible for these, maybe like new announcements or new big events that happen in the country. So what we know is that most of the responses that we get usually are over a period of 48 hours or a little bit more. So that allows us to control partially for some of these things.
Okay. I think there is another question, maybe. How much the debate in the parliament
could influence the behavior of citizens? That's a very good question. We don't have an answer to that. I think we can only speculate around, whether unity from policymakers and politicians is welcomed now. And it's more helpful or useful to increase compliance, for instance, or even just like trust with institutions or not. Whatever governments are doing now, I think will have definitely repercussions for years to come. History, in like the next few years, citizens in democratic countries will look back and judge how their politicians and policymakers have managed this pandemic. It's hard to tell now whether a heated debate is good and is healthy for democracy, or whether actually splits more people apart. We haven't control for that, so I don't know. I wouldn't have the evidence to answer that question for Italy. I am part of a study that is trying to answer that question in the US, and I can tell you that the pandemic in the US, for instance, is further polarizing pre-existing inequalities and people's views. So if people disagreed already quite a lot in the US on certain topics, now they disagree even more based on their political views. So the pandemic is not the great equalizer or this optimistic get-together moment in history for many countries. Definitely not for the US. For Italy, we don't have the answer to that, but we can only hope.
And there is a question on social capital.
I don't see
social
that.
Capital also play a role? You see it? Sure.
So you discussed the role of trust in politics. Mirco, do you want to?
Social capital, I think, I mean, most of these measures of compliance are actually altruistic acts. I mean, a lot of them. I mean, wearing a mask right now is mostly something that you do to the benefit of others. So that potentially can play a very important role. So we haven't worked too much on that with the data we have. So what we could see is that there was a gradient in terms of age for compliance. So young people were less keen on complying compared to middle-aged and elderly people. That could be because of a perception of risk, of course. And what we have seen is, again, I mean, that females were much more likely to comply than males. That may be related to, again, risk perception or something like that. We did explore a little bit the geographical dimension, and also, taking into account how different the pandemic affected different parts of the country, and we couldn't really see much. So we expected Lombardy and some other regions in the north of the country to be much more complying because the numbers were so much worse. But that doesn't emerge from a first look. We will definitely dig deeper because that's super interesting. And but if you have in mind this dichotomy in social capital, that doesn't seem at first glance to play a role.
I think Luigi Guiso in Co-Authors wrote something recently about mobility and social capital, I think at the province level. There are these data, I think, taken from cell phone about how much people have been moving during the past few months, and they are related to some measure of social capital. There seemed to be, maybe as expected, a relationship, a positive, actually a negative relationship, less mobility, less movements in more, intensely with regions with more social capital. But that's all there is. Definitely an important issue, interesting issue.
Yeah, other questions? I mean, compliance correlates with individual education levels. I don't think we checked, but makes sense indeed. And could you explore the data at the province level? So compare if higher compliance vary at this level rather than at the regional level. Yeah, I mean, bear in mind that the sample is small.
It's small.
To go so specific, because it's not even 1,000. So if we start splitting at the provincial level, maybe once we have all the waves, we can merge them and have a larger sample. But then it would be in a very different time, a very mixed situation. And given how much the situation changed, starting from March until now, that may matter a lot. And did you check for the timing of measures in neighboring or other European countries, such as going back to normal much earlier? Could this also explain isolation fatigue? Yeah, I mean, what we see is a change in time, but we cannot really isolate. Why is it? Is it just the passing of time that could, by itself, explain isolation fatigue, simply because you started earlier and it's going on for long, or is it other events? Maybe this we could check, looking at border regions that may be more sensitive to what happens across the border. Being in Bolzano, what happens in Austria is a really look at. But again, that may not be. We may not have a sample to be able to do it really. And the family composition of the respondents, do you have information?
I think we do. Yeah, it's demographic information we can look at.
We know if they have kids, for example, they're married, you know.
Yeah, so to be honest, we just started looking at the data set. We were kind of, you know, trying to push hard to get some results out about you know, these expectations about the duration of the lockdown, because we thought that that had first order policy relevance now. But then, you know, all the other issues that are very interesting from a behavioral scientific point of view, we put aside for the moment because of this, but definitely we will dig deeper into that.
Okay.
There is also a question, it's okay if it's off topic. How do you think the tracing app Immuni will be implemented at self by Italians? I don't know. I mean, with any app, the question is, you know, first of all, the adoption rate, but also the usage that people make of it. And it's very hard to control that. It's true, you can, you know, just leave the default that, you know, you get traced and everything, but it's really hard. It's really hard to tell, and also we get, you know, different messages from different politicians in different parts, stressing more issues around privacy as opposed, you know, to issues about public health. So it's hard to give a precise answer. Of course, we need some form of contact tracing. That's pretty much the consensus. But personally, and again, that's the point where, you know, we're allowed to have different opinions, even if you wrote the same paper, I suppose. I'm not very optimistic that people will. I mean, that we could get useful data out of. In terms of contact tracing from this app. Perhaps it's better than nothing, but it's going to be far from perfect.
But to me, you know, the only piece of information that we have that in the survey that could inform us, and that was quite surprising to me, was how many expect a second wave to come and the second lockdown to take place. So almost 80%. Some, you know, super pessimistic, you know, saying, you know, a few weeks after we open up again, we will go back. And some others, most of the people expected something in for the fall. So if that's the case, and if that is confirmed by the future waves, then I mean, people are scared of the whole process starting again. And if they get convinced that this app could be a way to avoid or to reduce the risk, or you know, to improve something along these lines, then it could be effective. Because people, to me, they are absolutely not optimistic. I was expecting something a bit different there. So, but yeah, it needs to be confirmed. So that we asked about 2 weeks ago that question, and now we are asking the same question. Let's see if people, because what we have seen in the previous waves, that people's expectation could change quite fast as things move. So maybe now people are much more optimistic once they see that you know, people are out in the streets and you know, nothing has happened. But or maybe if it's confirmed, it could be indicative that people are worried, and then if you convince them that that is a new useful tool, then people could use it.
Yeah. Yeah, I think it's also worth keeping in mind that the app is only effective if, first of all, most people download it and install it. Otherwise, there's probably no point. And the second point is that it only works and it's only helpful and useful if it's implemented and taken up in a timely manner. So we have seen, for instance, in countries that have adopted these solutions like Singapore or South Korea, from the moment they announced that they were going to do this to the moment that most people downloaded it, like more than 50% of the population, was a matter of days, probably weeks. In Italy, we have already transitioned to this reopening phase after 2 months or more of, you know, pandemic management, mismanagement of the situation, and we're still debating as to whether the app is useful, whether it's well designed, whether people will install it or not. So there is a risk that if the government places all their eggs in that basket of the app, then they're missing out on other important solutions, like what we're arguing, right, with this paper, which is that a lot of the times the cheapest solutions might be the most effective, such as think about a very good communication strategy. That might actually get you, quite there, as you are potentially exploring other solutions such as the app. So how it was going to be taken up or implemented or felt by the Italians remains a question that we'll only see, as Mirco was saying, in the next few weeks. But hopefully, in the meantime, policymakers in Italy will understand that they have another bunch of tools available to them to shape people's behavior and, basically encourage people to comply with certain regulations also around the phase 2 of the reopening, as they're figuring out the legal framework around the app.
Okay. Thanks a lot. Are there other questions?
It doesn't look like.
6 o'clock. We are perfectly on time. I don't see any other question coming. Okay, so really, thanks a lot to the speakers and to all the participants. I just remind you that we have another SIE seminar on COVID in 1 week. It will be Donato Masciandaro from Bocconi University, who will talk about helicopter money, and it's used for the current economic crisis due to COVID-19. Thanks a lot to everybody. I don't know if Marco wants to add something.
No, thank you.
No?
Grazie
Okay.
a tutti.
Grazie
Grazie a
a
voi.
tutti.
Grazie a
Thanks
voi.
a lot, especially to the speaker, for the very, very interesting and timely speech. And thanks a lot to everybody. Bye
Thank
bye.
you.
Have a
Ciao a
nice
tutti.
day for those across the Atlantic. Have a nice evening for those in Europe.
Grazie ancora.